Welcome to the self-administration training video for Hizentra, a 20% subcutaneous immunoglobulin therapy for the treatment of primary immunodeficiency disease, or PIDD. CSL Behring, maker of Hizentra, created this educational guide to help patients and their loved ones learn the proper techniques for the safe self-administration of Hizentra. This presentation should be used in conjunction with training provided by your healthcare professional. Individuals should only begin infusing on their own after thorough training and successful demonstration in front of a healthcare professional. The content within this video focuses on the general steps of administration and does not contain specifics about dosing or treatment schedule. Your doctor will develop an infusion plan that is individualized for you. Important safety information. Immune globulin subcutaneous human, Hizentra, is indicated for the treatment of various forms of primary immunodeficiency. If you have a history of anaphylactic or severe systemic response to immune globulin preparations or selective immunoglobulin A deficiency, check with your physician as Hizentra should not be used. If your physician suspects you are having a negative reaction or are going into shock, treatment will be discontinued. Because Hizentra contains the stabilizer L-proline, you cannot be treated with Hizentra if you have hyperprolinemia. Hizentra is derived from human plasma. The risk of transmission of infectious agents, including viruses and theoretically the Creutzfeldt-Jakob disease agent, cannot be completely eliminated. The most common drug-related adverse reactions seen in 5% or more of subjects in the clinical trial were local reactions, swelling, redness, heat, pain, and itching at the injection site, headache, vomiting, pain, and fatigue. Your physician will monitor for potentially serious reactions associated with intravenous immunoglobulin treatment that might also occur with Hizentra, including renal dysfunction and failure, osmotic nephropathy, thrombotic events, aseptic meningitis syndrome, hemolysis, and transfusion-related acute lung injury. IG administration may impair the effect of virus vaccines such as measles, mumps, and rubella. Before getting any vaccination, inform your doctor that you are using Hizentra. No overall differences in safety or efficacy were observed in patients over 65 or in pediatric patients. In the clinical study, Hizentra was effective in pediatric patients without specific pediatric dose adjustments. Please see full prescribing information and patient product information for Hizentra. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Before each administration, you should visually inspect each vial of Hizentra for particles or discoloration. Do not freeze Hizentra and do not use any solution that has been frozen. Check the product expiration date on the vial label. Do not use beyond the expiration date. The Hizentra vial is for single use only. Do not mix Hizentra with other products. Do not shake the Hizentra vial. Always use aseptic or bacteria-free technique when preparing and administering Hizentra. This will help prevent bacteria from getting inside the Hizentra solution. Never allow your fingers or other objects to touch the inner stem of the plunger, the syringe tip, or other areas that will come into contact with the Hizentra solution. Gather your materials. The following steps should be performed in order each time Hizentra is administered. Within a month or so of beginning therapy, and depending on the dosage, it should take approximately 1 to 2 hours to complete an infusion, and you will need to self-infuse once a week. You will need Hizentra vials, an infusion pump, a sharps container, and your treatment diary or logbook. You'll also need to gather other necessary items, such as infusion administration tubing, needles or catheter sets for subcutaneous infusion, Y-site connectors if needed, alcohol wipes, also known as antiseptic skin preparations, syringes, transfer needles, gauze and tape or transparent dressing, and gloves if recommended by your doctor. Thoroughly wash and dry your hands. If you have been told to wear gloves when preparing your infusion, put the gloves on as soon as your hands are dry after washing. Cleaning your surface. Choose an appropriate place to self-infuse Hizentra. This should be a clean, flat, non-porous surface, such as a kitchen countertop or table. Try to avoid wooden surfaces or areas that have crevices because they can be a hidden source of bacteria. Next, sanitize the clean, flat surface with an alcohol wipe using a circular motion, beginning in the center and moving outward. Checking the vials. You must inspect the liquid in each vial of Hizentra. It should look clear and be pale yellow to light brown in color. Do not use the vial if the liquid looks cloudy, contains particles, or has changed color. Also, do not use the vial if the protective cap is missing or if the expiration date on the label has passed. Transfer Hizentra to syringe for infusion. To do this, you will need to take the protective cap off the vial. You should hear an audible pop. Be sure to clean the vial stopper with an alcohol wipe and let the stopper dry for at least 30 seconds. Next, attach a transfer needle to the syringe tip. Pull the plunger to fill the syringe with air. The volume of air should be the same as the volume of Hizentra you will transfer from the vial. Now put the Hizentra vial on your clean surface. Keeping the vial upright, uncap the transfer needle and then insert it into the center of the rubber stopper. Check that the tip of the needle is not in the liquid. Then, to avoid foaming, inject the air into the top of the vial, not into the liquid. Carefully turn the vial and syringe upside down without removing the needle from the vial. Finally, keeping the needle submerged the entire time, slowly pull back on the plunger to withdraw the prescribed volume of Hizentra. When using multiple vials and syringes to achieve the prescribed dose, repeat this step. Take the needle out of the vial and cap it. Preparing the pump and infusion tubing. Take off the needle and immediately attach the syringe filled with Hizentra to the infusion tubing. Discard the needle in the sharps container. To prime or fill the tubing, gently push on the syringe plunger to fill the tubing with Hizentra until fluid can be seen near the end of the tube, but not as far as the needle itself. Be sure to prepare the pump following the manufacturer's instructions. Preparing the injection sites. Hizentra is infused subcutaneously. This means that it is infused into the fatty tissue just below the skin's first layer. Hizentra is not delivered into your vein. Infusion sites for Hizentra include the thighs, upper arms, stomach, and hips. Often the first choice for a site is the lower fourth of the abdomen, the area below the waistline on either side but not too close to the belly button. Your healthcare provider can help select the exact location and number of infusion sites. Hizentra may be infused into as many as 4 sites at the same time. While you can reuse the same area of the body each time you infuse, it's recommended that infusion sites be at least 2 inches from the previous sites. Never infuse into areas where the skin is tender, bruised, red, or hard. Avoid infusing into scars or stretch marks. If you are using more than one injection site, make sure each site is at least 2 inches from any other site. Once you have chosen locations, clean the skin at each site with an alcohol wipe and let the skin dry for at least 30 seconds. Inserting the needles. Use your index finger and thumb to pinch together an inch of skin around the injection site. Some larger patients may need to spread skin to locate an appropriate infusion site. Then insert the needle under the skin at a 90-degree angle. If necessary, use sterile gauze and tape or transparent dressing to hold the needle in place. Next, make sure you are not injecting Hizentra into a blood vessel. To test for this, pull the syringe plunger back slightly. Look to see if there is any blood in the tubing. If so, throw away the tubing and needle and start over by priming a new infusion tube and needle. Prepare a new injection site. If you are using a multiple site set, clamp off that site with a side clamp. Start the infusion. Follow the instructions on the infusion pump to connect the infusion tubing and set the infusion rate. Your doctor will tell you what rate to use for your Hizentra infusion. After setting up the pump, turn it on. Although most individuals will be able to infuse themselves, some patients may need assistance from a parent or caregiver. See your healthcare professional for equipment and supply options, such as a soft serter shown here. Recording your treatment. You should record the exact amount of Hizentra you infused, along with the date and time, in a treatment diary or logbook. Also, for your records, peel off the removable part of the Hizentra label from the vial and place it in your journal. You should go back later to record information about your infusion, including any side effects. Also, with Hizentra, you have the freedom and flexibility to carry on everyday activities while you infuse. Completing the infusion and cleaning up. When all the Hizentra has been infused, turn off the pump. Take off the dressing and take the needle out of the injection site. Throw away any Hizentra that is left over in the sharps container, along with the used disposable supplies. Clean and store the infusion pump following the manufacturer's instructions. The administration of Hizentra includes the following steps: gather materials, wash hands, clean surface, check vials, transfer Hizentra to syringe for infusion, prepare pump and infusion tubing, prepare injection sites, insert the needles, start the infusion, record treatment, and complete infusion and cleanup. If you have questions about Hizentra, call IGIQ, CSL Behring's single source for immunoglobulin solutions at 1-877-355-IGIQ. You can learn more about Hizentra on our website, hizentra.com.